The main reason people have kind of gone away from buttock implants and moved to fat transfer is, one, it's your own tissue. You don't have to worry about an implant. You can also control the shaping that you're creating when you're doing fat transfer or the BBL. And the main risk of having the butt implants tends to be infection, and if that occurs, you have to take that implant out. So whether that's one side or both sides, that can be a real setback and a problem, especially if it's one-sided only, because then you're walking around asymmetric until that's healed and a new one can be placed. What is a Brazilian butt lift? A Brazilian butt lift is also commonly called BBL for short, and what that means is you're taking fat from somewhere else in the body, usually the abdomen or love handles or lower back, and then you're injecting it to the buttock itself. And what that ends up doing is it changes the shape, and so it tends to make it look rounder, and it does make it look lifted. So you haven't surgically taken skin out or anything to lift it, but you're lifting it by adding volume to the upper part, and that gives it a lifted and higher, rounder appearance. Can you lift loose buttock skin with the BBL? So if you think about it, you're essentially filling that loose skin, and if it's mild or moderate, you will end up lifting it to some degree. If it's a lot of loose skin, you won't really lift it without transferring a lot of fat, and that may not be aesthetically the goal. So for patients who really have a lot of loose skin, you may also need a surgical excision of the skin to lift the skin itself, and then also transferring fat. So the recovery process after a BBL is really important in terms of how successful that BBL will be. The main thing we want patients to do afterwards is to avoid putting a lot of pressure on the butt. So that does mean you're avoiding sitting in a way that you're putting pressure on it. So for approximately 8 weeks after surgery, we want you to actively avoid putting a lot of pressure on the butt, and that means you may sit elevated on a chair, like there's a little pillow that you can buy that goes under the thighs to prevent any pressure on the butt itself. Even when you're sleeping, we recommend don't lie on your back during that time, just because we don't want all of that pressure on that area while that fat is trying to heal, because it needs good blood supply in order to take, so it doesn't get reabsorbed.